In health news, the last thing you want to deal with during the hectic holiday season or any other time, really, the flu or a muscle strain or another problem that might need some attention from a medical provider. But if it does happen, Spectrum Health now is here to help. You can use your phone to conduct a video visit at your convenience and from anywhere in Michigan. Here to talk about the telemedicine service is Spectrum Health now lead provider and physician assistant, Elizabeth. Good morning. Thanks so much for being here.
Thank you.
All right, so a video visit. Explain this to us.
So a video visit is the same thing as a normal medical visit you would get in the office, just utilizing the video technology. So you download our app onto your smart device, phone, tablet, you can even do it on a PC, and you see one of our providers through there from video.
All right, so what type of ailments are we talking about that you guys kind of will deal with these video calls?
Yeah, low acuity visits. Right now we're seeing a lot of cold, cough, flu, sore throats, rashes, nausea, that type of thing.
All right, so there are certain things like a sinus infection or a muscle strain. How do you go about kind of diagnosing those or helping people with those things just by a video call?
Right. So we have different guidelines that we follow for certain diagnosis, and then we still take the history just like we would in the office, and we have a virtual way of doing a physical exam even.
Okay. So once you talk to the person and you're like, okay, you know what, I think you're going to need a little bit extra. They don't just drop you and be like, okay, good luck with that.
No.
What's kind of the next step?
No, absolutely not. So if we find that you need a higher acuity of care, we escalate you on, back to your primary, urgent care, ER, whatever that may be. We kind of help facilitate you to go to the right place.
Seems like everywhere we turn in the office, we have a cough room here.
Oh,
people
good.
they go in there when they have to cough. So this time of year, what kind of uptick are we seeing with everything? You mentioned the flu and that sort of thing, but really.
Yeah, we have started seeing some flu even a little earlier than last year. We saw that more in January. We have started to see that now in December, and then a lot of the cough and cold, a lot of chest colds right now we're seeing.
My head just feels like I've been swimming. That's kind of where I'm at right
Yes.
now. And that's going to continue to probably about April.
Right.
I say I'm just going to kind of live with it. It happens every year. But for those people who actually are concerned about the cost of this, a lot of people hold back on their health because they're worried about that.
Right. So we are less expensive than going to urgent care, going to the ER definitely. The max it's ever going to be $45. A lot of the insurances, however, cover it, so you may have a $0 copay.
All right, so definitely worth getting an app you set on your phone.
Yes.
You can get it on your PC, and also you can just go ahead and use it from your iPad or something like that too. And maybe you can do it right on your coffee break at work.
Exactly. You can be at work, in your car, at home, in your bed, doesn't matter.
What are people saying about this?
They love it. We see people time and time again now. Once they've done us once and it worked well, we'll see them again. We'll see their kids. We'll see their family members. So it works well, especially around the holidays when you don't want to go into urgent care and wait, or it's maybe not that high of acuity to go to urgent care. We can see you where you are and get you feeling better and back to your holiday festivities.
And on the flip side of it, when is urgent care a must?
Yeah, so if you have any sort of trouble breathing, you're short of breath, you can't catch your breath, you have high fevers, they're not coming down with Tylenol and ibuprofen, chest pain, that type of stuff, we want you to be seen in person.
And especially with the little ones, right?
Exactly. We only see 3 and over.
Okay, 3 and over right there on the video service. Good thing to point out for everybody. Don't mess around with that. Err on the side of caution,
Exactly.
I always say. All right, well, thank you so much for stopping by. This is a
Thank
great
you.
service that you guys provide. To learn more, you can go to spectrumhealth.org/now.